So next, after epistaxis, is the sponsored lecture. Who is the lecturer of the sponsored lecture? Oh yes, here he is already. Yeah, then we are curious what we will learn now about sympathetic denervation of the liver.
Okay. Good morning, everybody. Always a pleasure to come back to Sofia, sunny Sofia, and be part of the Balkan Endovascular course. And Medtronic obviously is a sponsor. We're going to continue to be involved with this society. My name is Stefan Tunev. I'm a full-time employee of Medtronic. I serve there as the senior distinguished scientist and a fellow of Medtronic, but my brain has been shaped by over 30 years of pathology. I'm a pathologist, so you'll see some of that thinking. We started a new program at Medtronic called Gemini, Spyral Gemini program, and I'm going to introduce that to you. It's a very bold move. We're building on our spiral denervation, renal denervation program, and we're going to a different geography. As you all know, hypertension is a big problem globally. A lot of people are affected when a lot of people die because of hypertension. 1 billion of people worldwide have the disease. Of course, that's a great source of income for pharmaceutical companies, as you know. However, the regular patient still refuses to take the entire regimen, and 65% of the people are either resistant or uncontrolled. And hypertension continues to be a problem, and that creates an opportunity for medical device companies and interventional cardiologists and radiologists to do something else than pharmacotherapy. And that something else is called renal denervation. It's a procedure that we recently got approved. It's getting approved globally and getting reimbursed. And basically, it runs on the premise that the hypertension is oftentimes pre-medicated with overactive sympathetic system. And that procedure is aiming to reduce the sympathetic tone in the kidneys and reduce the connection between the kidney and the brain, the crosstalk, and kind of reduce the hypertension that way. So it's still in development. We're doing this, I think, in most countries in the world. It's a very interesting, attractive procedure, including in Bulgaria as well, in the Balkan Peninsula. This is our device called Simplicity Spyral, very simple device. You will hear more about it after me. Professor Petrov is going to give you an excellent overview of the procedure on renal denervation, and you can see the generator here. But I'm going to talk to you about something different. Okay, what this procedure does very quickly to kind of give you a very short course is that we utilize a very interesting phenomenon that in our body different tissues have different resistive indices to electricity. So RF is an electrical current. When you put it in the body, it goes differently in different tissues and preferentially hits some of the tissues. It turns out it hits fat, and you can see here, I'm going to point out, this is renal artery, lymph nodes, muscle, and the fat around the renal artery gets ablated, and where the nerves are, that's where the nerves are. It spares the veins, it spares the lymph nodes. It's a very interesting therapy that goes periarterially and does these ablative lesions. So the question was, can we do something else with this? We also learned throughout the years of doing renal denervation that renal denervation is a very unique therapy. It kind of improves over time. These are different trials. Here you can see 4 different trials. One is a pilot, and if you follow them from 6 months to 3 years, you can see that the effect deepens. We call this always-on effect. The renal denervation is not a pill. Once you have the procedure, it's always active in your body. And it's very important because it acts when you don't take drugs. For example, early morning hours, 2 o'clock, 3 o'clock in the morning, you may not have enough pharmaceuticals in your body, but you always have this protection from renal denervation. So the question is, can we actually make this better? We constantly talk to physicians trying to figure out what's on their mind, and this is a priority list for renal denervation, and shows that blood pressure drop and responder rates is the number 1 and 2 concerns, and we decided to address them with this particular program by going to the liver and the kidneys. So you're going to denervate both kidneys and the liver together, and that program is called Gemini, multi-organ denervation. Animal studies early on, this is 20 years ago, have shown that if you denervate multiple organs, so-called A plus B effect, you have bigger drop in blood pressure. These are studies in hypertensive rats, and a lot of people experiment with them, but the more organs you denervate sympathetically, the bigger the drop in blood pressure in animals. Now, this opens a whole new opportunities because it's not about blood pressure. Liver is a metabolic organ. It's very complicated there. And so you're going to talk a lot about cardiometabolic syndrome and glucose metabolism, diabetes, all of these things. And so we recognize that this is a complex field. However, for the first step, we decided to focus our program specifically on hypertension. Okay, and this is a strategic rationale. We're going to go into the multi-organ denervation specifically to find out if it can improve the blood pressure effect as compared to renal denervation only. Okay, so here's some examples. Common hepatic artery, we're going to denervate in the common hepatic artery, is defined as the artery between this is the splenic and gastroduodenal. That's the common hepatic right here. We're going to perform the denervation there. And you can see some variations on the right side. Of course, every human is different. There's a different branches, etc. But the purple arrow in those lines shows the common hepatic artery. It's fairly well accessible to the celiac trunk. And you're going to do kidney, and common hepatic artery with the same device and be done. Histologically, we know that that's a very rich organ, sympathetically well innervated. Lots of nerves there. This is a paper by Felix Mahfoud, and we also have our own internal studies showing this. In comparison, interestingly, with the renals, we learned that proximally the nerves are all over the place. As you go distally towards the kidney, they become very close to the artery. However, in the hepatic, not only they're very close all the time, but you have a constellation of multi-layer bigger nerves, so there's more targets, so to speak, but that makes sense because the organ is much bigger than the kidneys, and the common hepatic supplies the pancreas, the stomach, and the duodenum. So you're actually denervating a multitude of organs here by going to this location. Okay, preclinically, the question was, can we go and do this with our device, one generator, one procedure? So here's the common hepatic artery in a pig, all the dimensions here. Here's how the device looks in it. You can do 2 ablations, 8 electrodes total, so 2 concentric ablations, in and out very quickly, very easy, and no side effects for that study. And if we look at the lesions, this is the renal lesion, how we ablate the fat. Let me point out. So here's the renal artery. This is all fat, retroperitoneal fat, nerves, and the lesion basically ablates the fat and the nerves. And it can go deeper if there's a lot of fat. In the liver, we have a very similar lesion. In this particular slide, it's limited by the portal vein here, but lots of big nerves, and it's kind of also in the periarterial fat. So the lesion is very similar between the renal and the hepatic with the same device. And if you look at the effect, in animals, we don't have hypertension, and you measure the effect by measuring how much norepinephrine is in the end organ, in the kidney cortex or in the liver. And you can see here there's a massive denervating effect. By removing the nerves to these organs, the norepinephrine content in the organ goes down. In fact, in the liver at 7 days in these animals, we saw 95% reduction of norepinephrine. Now, bear in mind, this is a massive organ. It's a very big organ. To remove 95% of the sympathetic system in that organ is a very big thing, and that effect sustains to 28 days in the animal study, so the nerves don't grow back. It's a very durable procedure. We're not the only ones doing this. There's another company, a startup called Metavention. This is their paper. They have a different system, still RF, radio frequency, and they've gone to animal studies. These are their angiograms between the hepatic and the renal, and they've shown that in 90-day studies, the procedure is very safe. They've done extensive metabolic panel for the livers, and none of the animals show any statistically significant differences in liver metabolism between baseline and 90 days. So it's safe to perform. The animals didn't feel anything. They also showed the reduction of norepinephrine in the liver and the kidney, but they also looked at these other organs I told you, pancreas and duodenum, not the stomach. And you can see by denervating the common hepatic artery, you have a reduction of norepinephrine in the pancreas and the duodenum. So this becomes a true multi-organ GI denervation that we think has a lot of potential to explore clinically. Okay, so clinical trial, what do we do next? We have a clinical trial called a Spyral Gemini pilot. There is a prospective global multicentral clinical trial. It's the United States, Europe, and Australia, New Zealand. Small one, 175 patients. The PI is Dr. David Kanzari, and you're going to hear from him when we finish. We're currently enrolling, and we have 10 patients done already. The trial will have 75 patients in a arm called off-med, so we're going to assist, retain them from medications, and 100 patients on med, and they're going to be followed 1 month to 3 years. And again, the primary endpoint is reduction of blood pressure, specifically. However, because this is such a hot topic, and we recognize that this is a metabolic potential, we will also, if you look at here on the lower here, we're going to do some exploratory studies in glycemic control. We're going to require these patients to wear some of those continuing glucose monitors, and we're going to measure the glucose content in 3 years and see what happens, just as an exploratory study. If this is successful, we probably have to follow this with much bigger studies to investigate where this therapy fits and what can we do further in diabetics, for example, or cardiorenal metabolic syndrome, or metabolic syndrome as a general. The cardiorenal metabolic syndrome is becoming a huge topic of discussion in the United States. The CDC published a paper last month stating that 80% of American citizens have some form of this condition without knowing it. So obviously the Western diet and the lifestyle in the United States is very different and causes this sort of thing. But as people live longer and they have statins and medications, we're going to see more of these metabolic syndromes coming in. And modulating the sympathetic system may become a way to augment this specific condition. So that is my talk. I have 3 minutes for questions. Thank you.
So there is one question, please.
We do renal denervation on a patient. We go successfully, the blood pressure lowers, but let's say 3 to 4 years later, he develops hemorrhagic shock. Will this procedure alter the shock response in this patient and increase mortality?
Okay, great. Yeah, that's we did a lot of risk analysis for a lot of things like that. This is not expected to. It's already tested for the renal denervation. It doesn't alter the shock. The reason for that is that when you go into these shock systems, the main actor in those flight or fight responses is the adrenal medulla. That's where the norepinephrine comes in. We're not affecting that. That's number one biggest factor. The second biggest factor is that these procedures do not alter the ganglia. Like if you go and do celiac ganglia ablation, that's a completely different procedure. We don't alter the main cellular bodies of the neurons, the sympathetic neurons. We only disconnect the axons, and the ganglia still live. So the entire sympathetic system is functioning. It can trigger a very good adrenal response, the medullary response, and be there. So no danger with that.
Thank you.
But we have to test that, of course. That's an important thing. Thank you. More questions?
Are there any other questions? I don't see. Naturally, we are curious what will follow now in the future. I have only experience with renal denervation, but I have never done it in the liver artery, and so perhaps we have other organs where we can also denervate it. That is something certainly not for mild hypertension, where yes, when somebody has at rest a blood pressure of 150 to 160 millimeters of mercury, but when somebody has a blood pressure of 180 to 200 or more at rest, then he needs more than only medication. I think then it will be helpful.
Yes.
So thank you very much for your presentation. We go on in